I mean, first starting with the gut and looking at what's going on functionally inside the gut, looking at inflammatory markers, looking at the gut microbiome, looking for any signs of yeast, bacteria, parasites, whatever might be disrupting gut health. Because to me, that's the root. It's like if you're working on a tree, you're first going to work on the root system, and the root system of the body is the gut. So starting there, but I also believe in the bidirectional pathway, the gut and the brain working together. So I'm always also working on mindset and the mind and how the person is approaching life and how they think about things. Because I think that is a very important piece of the puzzle.
Dr. Vincent Pedre is the medical director of Pedre Integrative Health, the founder of Dr. Pedre Wellness, and the founder of Happy Gut Life. And he has worked as a nutraceutical consultant and spokesperson for NatureMD and orthomolecular products, and is a functional medicine certified practitioner with a concierge practice in New York City since 2004. As the best-selling author of 2 books on the gut, he believes the gut is the gateway to excellent wellness. His new book, The Gut Smart Protocol, featuring a 14-day personalized gut healing plan based on the Gut Smart quiz, is a culmination of years of research and clinical experience as a functional gut health expert. Welcome, everybody, to Take Back Your Health. I am so excited for today's guest, Dr. Vincent Pedre, who is a functional medicine expert as well as a gut expert. And you all know how much I love the gut, so I'm super excited to interview him today to hear all about his knowledge about the gut-brain axis. Welcome.
It's great to be here with you. Congratulations on this new podcast. And thank you for having me on.
One of the things that I like to ask all my guests is their story, but I'm really interested in yours because I actually don't know your story because you are a conventionally trained physician, as am I, but then somehow you got into functional medicine in the gut. So could you first start off by just sharing your story, how you got here?
Actually, I always think like when I get asked this question that there's always more than one story. The beginning of the story dates back to before medical school, when I was pre-med, and the idea of becoming a doctor and caring for patients was a combination of science and humanitarian love, like wanting to help people. And then there was a reality that when you go to medical school, there's going to be needles and there's going to be, like actually like poking people. And the thing was that I was incredibly afraid of needles as a kid. And even through college and pre-med, every time I had to get a shot, a vaccine, anything, I would pass out. If I had to have my blood taken, I would just be in a nervous tizzy, like going to the doctor's office, knowing that I was going to pass out. So finally, I do my MCATs, I get into med school, and I tell my parents, I don't know if I want to become a doctor anymore. Because now the reality of like, oh, this isn't just science and theory, like I'm actually going to have to go and do things, and they're going to involve needles at times, and I can't be around needles. So I finished college a semester early, went home to Miami, and started thinking about this and started reflecting on, well, what is happening inside my body? What is this that it feels like it has its own mind in that moment when I have this vagal syncope and I pass out every single time. So I went to the bookstore, went to the library, and I started researching and discovered the parasympathetic, sympathetic nervous systems, the autonomic nervous system, and how it's reacting in this way. And I started looking into, well, is there a way that I can get this autonomic nervous system that's operating automatically in the background? Is there a way that I can bring it under conscious control? And I discovered through that meditation and breath work. And soon thereafter, yoga. So before I went to a traditional medical school for 8 months, I had been doing breath work, meditation, changing my internal environment, the way that my body responded to stress, so that I could get my Hep B vaccine series and not pass out. And luckily I could delay, like they allowed you to enroll as long as you had your first shot before the first day of medical school. So I waited until the very last moment to get my first Hep B shot. And that day I went into the office, I went to the medical campus, and I could feel my heart rate starting to go, the sweat coming. But then I used everything. It had been training, like breath work, meditation, visualization, and I didn't pass out. And that to me was one of the most powerful shaping moments of my career and the trajectory that my path would take in medicine, because by then I knew that I wasn't going to be a standard doctor anymore. Mm-hmm. And I had experienced the power of the body without drugs, without anything, just using the breath, just using the mind, visualization, to change the internal environment in a positive way, that I knew that's the type of doctor that I wanted to become.
I love that story. And I love hearing people's stories and finding out, things that I don't know about them, and then similarities. It's kind of ironic that I became an ER doctor, because I too, now I've had so much blood work and so many needles, I don't pass out, but I still request the butterfly needle. And I was the person in med school that was like, when we had to practice phlebotomy, I was like, I'll practice on you, but you cannot practice on me. I was so stressed after my first year of undergrad. My mother took me to transcendental meditation, a weekend, seminar to learn how to do transcendental meditation. Now, let me ask you this. When I went into medical school, I was older, and, I knew I wanted to do something like functional medicine. And my mother had passed from pancreatic cancer. And so I went in, which it sounds like you, with this very different view of how to heal. And so getting through medical school, and even, sometimes working as an ER doctor, was very difficult, because I knew that there was a different way, potentially a better way. How was your experience in medical school? And then, was your residency in internal medicine, or?
It was almost like a dual tale of two cities.
Right.
Because the other thing that I did while I was meditating and breath work and all that is there were two really influential books that had just been published. One was Spontaneous Healing by Andrew Weil.
That is the book that changed my life too.
And the second book was Quantum Healing by Deepak Chopra. And those two books came out about the same time. And I read those during that time that I was like exploring the breathwork, meditation, and yoga. So by the time day one of medical school came, my mind was so cracked open to the possibilities beyond what we were going to be taught. There was nothing they could say that would close my mind at that point. I still kind of understood, like, well, I'm going through the process. It's going to be good to have an MD behind my name. I wasn't sure where things would go. I didn't know about functional medicine. I think at some point I started discovering Dr. Mark Hyman and reading some of his books as well. And really, for me, it was like, it was almost like these two parallel lives, like, going to medical school, doing everything that I needed to do to be as excellent as possible as a Western physician, learning all the pharmaceuticals, everything. And on the flip side, using meditation and going to yoga on a regular basis as the way to stay balanced while living this crazy, stressful life as a medical student. And then getting into, at the time, I graduated in 99, so there were no integrative medicine residencies back then. I know. So you still had to kind of figure out, like, okay, I know where I want to get, but I have no idea how that's going to happen.
I mean, that's why I became an ER doctor, because I was like, I'll be able to get out. In my fourth year, I did a internship with, or a rotation with Andrew Weil, and, went and thought, oh, I'm going to do that, family medicine, do that. And then I thought, well, this is just kind of sending people to go do meditation and go do yoga, but it's not getting to the root. So I changed my whole, I had residency interviews scheduled for family medicine, and I canceled them all and changed to ER after that. I mean, yeah.
I would have never thought that you were an ER doctor. And for me, like when I was in training, like I loved the heart. I loved the lungs. Like there were times that I thought, oh, I'm going to be an intensivist or I'm going to do this or that. And finally, I just was very cerebral and I loved the theory of medicine. So I think that's why I ended up in internal medicine, because it basically is everything and you have to know so much. So I did my training and it was during those years that I feel like I started slowly losing myself, because I felt like I was being taken further and further and further away from where I had started with Deepak Chopra and Weil and all that. And I actually interviewed at some point, I think after my training, I interviewed for Andrew Weil's program, but actually decided that I didn't want to do it because I went a different direction. So after I finished my residency, I was pretty, I don't know if you felt this way, but I was pretty burnt out. I was just like, HPA axis dysfunction, adrenals were shot. My body was just destroyed. And at that time, I had also grown up with a lot of gut issues, been on 20 plus rounds of antibiotics.
Wow.
I didn't know that wheat was a problem, and I was still eating wheat. So I was getting through residency, feeling sick to my stomach, having pizza, not knowing why I was running to the bathroom afterwards, thinking, well, this is like everybody eats this.
Of
like
course.
they were serving pizza at our afternoon lectures in the hospital.
Oh, and you go into the ER in the morning, or you go in for a midnight shift and there's donuts and coffee and, of course.
No, and I would get through a night shift at the hospital, with sugar, like at 3 a.m. The only thing that's going to keep you going is like, I would go and get some M&Ms to get me through the rest of the night. It's very unhealthy. So by the end of it, I was burnt out and actually did what I call my sabbatical year. I ended up working with this program that kicked off, and I was part of the initial group that started the World Trade Center worker screening program that was for people who had been exposed to the World Trade Center site after 9/11, that had worked in recovery and they were inhaling the fumes and all that. And that gave me a breather to kind of reorient myself. And during that time, I went on this vacation with a friend of mine to St. Lucia. And there was a yoga teacher that was visiting, and we did yoga every single day, meditation yoga every single day. And by the end of that week, I felt better than I had felt in a long time. So I came back to New York and I started looking for yoga teacher trainings, and there was one that was starting within a few weeks. And I enrolled in this yoga teacher training. So here I am, just finished medical school, residency also. And now I'm enrolling in a yoga teacher training. and it was what actually helped me rediscover the aspects of medicine, the angle, the more holistic Eastern philosophy that is what I really wanted to be a part of my practice. And it was through the yoga that then I started looking at people holistically, because I don't know if you felt that in ER medicine, but in internal medicine, like we used to walk down the hall in the hospital and just point to a room and say, oh, there's the heart attack, there's the pneumonia, there's the liver failure. Like people were called by the organ system that they were in for. They weren't treated as a whole person. And it was through yoga, like looking at the body, looking at how people breathe, stand, it brought me back outside of the body, and I started looking at the whole person. But I realized at the time that I didn't think, at the end of it, I'm like, well, what am I doing? Like, I have a medical degree. Like, am I now going to become a yoga teacher? Like, I couldn't figure out, well, what is it I'm going to do with this other than, okay, it helped me tune back into where I really want to be. And it was the yoga that led me to acupuncture. So I trained in acupuncture, where I learned systems biology. And it wasn't until I did acupuncture that functional medicine started making more sense to me, because it's basically an extension of that systems biology approach. All of that time, I was reading Dr. Hyman's books and finally was trying to find where I belonged, because I felt like a fish out of water. Like I was in a sea of standard doctors here in the Upper East Side of Manhattan, and I was trying to do things differently. And everybody looked at me as I was strange. And I had started practicing acupuncture, and they're like, they would just look at me, that thing you do. I'm like, well, that's a 2,000-year-old tradition called acupuncture. And it was through acupuncture that actually understanding systems biology that I finally found my way to functional medicine. And when I went to that first conference, I felt like I had found my long lost family that I had been looking for my entire career.
Tell us, how, very quickly how you got into the gut. And then I'd love to talk about the importance of the gut, and then the gut and brain connection, because we have so many people suffering more now than ever with anxiety, depression, ADD, ADHD, and there's such a connection to the gut. So I'd love for our listeners to hear your takes on that.
As a teenager, I started getting sick a lot. And my parents would take me to the pediatrician every time I would get an antibiotic. This was happening 2-3 times per year, every single year, year after year, to the point that I was a hypochondriac and I was afraid to be around other people that were sick, because I just thought I had this weak immune system. Little did I know that everything was getting weakened. The more antibiotics I was on, the more it destroyed my gut microbiome, the more it was causing leaky gut. And the two biggest food groups in my diet, dairy and wheat, were destroying my immune system. So by the time I had gotten through medical school, I had actually started changing my diet, and was always, my dad was very much into supplementation and diet. So I was attuned to paying attention, even though I didn't know what exactly the right things to do. But I had reduced my dairy intake in medical school, and I stopped getting sick as often. So I made a connection between dairy and getting sick and started being careful about dairy. But I still suffered a lot from not understanding why my gut reacted in different ways. And even throughout residency, like I was still having pizza, still having bread, like not knowing that was how damaging it was to my gut. And it wasn't until I discovered functional medicine. At that point, I thought, well, I'm just going to have to live with this for the rest of my life. Like, this is just my lot. My older sister has an iron stomach. I inherited the sensitive stomach, and that's just the way it is. And I was just resigned at that point, because what am I going to do? Like, be on antidepressant? Like, I wasn't going to get treated for IBS with the medications that I knew were just Band-Aids for it. But I didn't know what was really behind it, the gut microbiome and leaky gut and all that, until I got into functional medicine. So it was first for me, it was like I healed myself through functional medicine, and that fueled my passion for the gut and looking at gut health issues with my patients. And just over the next couple of years, when I started practicing functional medicine in around 2006, 2008, I just accidentally overnight became a gut expert, because people would get better. They would refer their friends, they would refer their work colleagues. And before I knew it, I had this practice that was a lot focused on gut health. And that was the impetus to finally write my first book, Happy Gut. That was back in 2016. So it was a passion that came out of me being the patient, seeing the transformation that I experienced through changing my diet, introducing fermented foods, probiotics, fixing the leaky gut, and working on that, and then working with hundreds of patients.
So now looking back, knowing what you know, and we'll get into the gut-brain connection, do you think that some of this anxiety around needles and procedures and things like that may have stimulated from an imbalanced microbiome and eating gluten and dairy.
We know that the gut microbiome controls a lot of things, including nervous behavior, or even how it actually imprints the amygdala early in life. So they've done studies on germ-free mice where they look at, well, what happens to the amygdala development under a stressful situation, and the amygdala becomes hyperreactive without the presence of Bifidobacterium infantis. So then we think about like children that are not breastfed. That was me. I was born through vaginal delivery, but I was not breastfed. My mom didn't have a lot of breast milk. And back then in the early 70s, they were telling mothers that formula is better than breast milk. So right there, I missed that early, very important imprinting of the gut microbiome. So that could have actually had an influence on my high levels of anxiety as a child, and the worrying. I think there's also imprinted behavior. Like my grandmother was a very nervous person. I think you also absorb and learn from your environment. But yeah, I think that there was also an aspect of that gut-brain connection through different means, because we know that meditation also alters the gut microbiome. And then when somebody's on constant fight or flight stress, that's also going to increase gut permeability, and that's going to alter the gut microbiome and cause dysbiosis and imbalance between good and bad bugs. And how many people out there are living in fight or flight mode all the time? For me, the meditation was the first thing that really started to change the way that I reacted to the world. And at the same time that I started doing that, I also changed my diet. I stopped getting sick as often. So you wonder, how did all these things influence each other? Because the gut microbiome plays such an important role as well.
Just getting back kind of to the basics, why do they call the gut the second brain?
The enteric nervous system is not as big as the brain in terms of neural connections, but it has a significant amount of neural connections. And I think of it like the gut is giving feedback to the brain through different avenues. One of them is the vagus nerve, but also through postbiotic products like short chain fatty acids that are getting across the blood-brain barrier. And in many ways, controlling the way that the brain reacts to the external environment. And we saw this in a study that they did in Ireland, where they split a group of people. It was about 45 people. They split them into two groups. One group was put on what they called a psychobiotic diet, and the other group was just given the standard Irish food pyramid recommendations, which is very similar to the American food pyramid. Maybe at the bottom it's potatoes instead of wheat. But it basically, one group was given just standard recommendations: don't eat excess sugar, don't eat processed foods. The other group was told to increase their fiber intake from an average of anywhere between 15 and 20 grams per day to 40 to 50 grams per day, which is equivalent to about 4 to 6 servings of fiber. And they were also instructed to increase their intake of fermented foods. Typically, pre-study, the participants took about maybe an average of 0.5 cups of fermented foods per day, half a serving. And they were instructed to go up to 2 to 3 servings per day. And then they looked at their perceived stress score. They used a test called the Cohen's perceived stress score before and after, and they measured their gut microbiome as well. So if we call the standard diet group the placebo group and the other one the intervention group, what they found was that the intervention group dropped their perceived stress score by 37%.
Wow.
Versus the placebo only dropped it by 17%. So there was a statistically significant difference between the two, and there was a measurable change in gut microbiome diversity in the perceived in the group that responded. And they also actually had the participants log their dietary compliance. And they found that the higher the dietary compliance, the greater the drop in the perceived stress score. And this was all done without any type of cognitive therapy. So to take out like any effects, nobody was on any psychiatric medications. There was no cognitive therapy. So they were just looking at what happens if you change the diet. Does that change the way that we perceive stress, how stress affects us? And it seems that it did, using what they call this psychobiotic diet.
You think that that was simply, or not simply, but obviously our microbiota is feeding off of these fermented foods, utilizing the fiber, and then, likely changing the microbiota diversity and amount. So is that sort of the theory behind what has occurred there?
That's the theory. And by doing that, we know from other studies that high levels of inflammation are connected with depression, and that there was another big study, I think was done in the Netherlands or Denmark, where they looked at the connection between the gut microbiome and people who were depressed versus normal people. And they saw that there were differences in the taxa, and that people who were depressed had more inflammation producing gut microbiota than people who were not depressed. And some of those actually are involved in the metabolism of L-carnitine and phosphatidylcholine into TMA, trimethylamine, which then gets converted into TMAO, which increases the risk of heart disease, heart attack, as well as stroke, but also actually is associated with depression as well. So the idea is that improving the gut microbiome lowers inflammation. And by lowering inflammation, you're actually also improving brain function as well. So it's having an effect on the brain.
And I don't know if you experienced this in your clinic, but I certainly saw both with anxiety and depression, but more specifically with depression, a lot of people having candida overgrowth. And, I would always explain it that sort of candida lays this layer over your gut, as and can even have, all kinds of, creating the root and the biofilm. And then 90% of our IgA is secreted and 95% of our neurotransmitters are, produced in our gut, and that this inhibits the ability to produce those. And so, often, people would have low serotonin, but then we would get rid of the candida and get rid of that biofilm. And then they were able to naturally produce these neurotransmitters on their own. So I don't know if that's something that, you also experienced in your clinic, is seeing, that was a pretty classic and major thing that I would see with folks that were depressed. And even, ADHD and ADD as well. And
also candida or yeast overgrowth can produce mycotoxins that then affect brain health. The other, I think, really interesting thing is, when we talk about serotonin production in the gut, I think a lot of people think that, they correlate like, well, the brain produces serotonin, that's the happiness molecule. And then I started looking into it and found that serotonin actually is too big of a molecule to cross the blood-brain barrier. So the serotonin that is being produced in the gut is actually influencing the brain through a different mechanism. It's not that it's getting into the brain and increasing brain serotonin, but there are serotonin receptors at the end of the vagus nerve. And so that gut serotonin is sending a signal to the brain through the vagus nerve that is then affecting how the brain is functioning. And we know this from studies on vagal nerve function, or like treatment resistant depression, where they're not responding to anything. And they used the vagal nerve stimulator on these patients and found that they were able to reverse 37% of cases of treatment resistant depression by stimulating the vagus nerve using an electrical, an external vagal stimulator. So we know then the vagus nerve plays a very important key role, and being able to activate the vagus through the gut and through the gut microbiome is a very key, important part of brain health.
Let's talk, ADD and ADHD. Do you have, either any stories of patients you'd like to tell us or, associations like we just mentioned with the serotonin and candida and depression? Anything that you've seen that that is a correlate to ADD or ADHD?
I think the other thing that we need to think about in these cases are food sensitivities.
Mm-hmm.
Especially, I mean, it seems like cliche now that we talk about this, but wheat sensitivity, gluten sensitivity seems to be now at epidemic proportions. Maybe our view is skewed as functional medicine practitioners because we see the sick people have not been able to heal by any other fashion. But we have to think about how gluten increases intestinal permeability, and also gluten metabolites become morphine-like substances, gluteomorphin that gets to the brain, and it can affect focus, attention, all of that. And same thing with dairy as well. So with these patients, I think you're always navigating a combination of dysbiosis, so the intrinsic environment being off, and that's causing a whole host of problems, whether it's yeast, candida, or any other type of, overgrowth of bad bugs, and also food sensitivities that are also fueling the problem, as well as like things that may not be sensitivities, but like artificial sweeteners, eating too much sugar. There's always, like, as a confluence of factors that are coming together.
The dyes. Yeah, of course.
I personally think that I understand that people with ADD, they respond to ADD medications. Sometimes they feel like they get better with them. But I also think that we should not make ADD a disease per se. Like the brain of the ADD person functions in a different way than what is societally acceptable, right? Their brains have this ability to connect abstract things together. So they were looking at this in Africa, the difference between hunters and civilizations or tribes that developed more of an agricultural practice.
Mm-hmm.
And they found that the hunter brain had a more dopamine reward system that was very similar to the ADD brain. And it functioned really well for them because as a hunter, they have to be like really alert. They have to be able to see things really fast. They have to be able to switch their attention fast between one thing and another. Whereas someone who's raising vegetables needs to be really focused, needs to have a lot of patience, needs to see the long term. And it seemed like, the people who were hunters were specialized in being able to do this really well. And the people are not. And I think in our society, we're trying to make everybody farmers, but not everybody's a farmer.
And maybe one day we'll have almost, these are the types of brains and they're all normal, but let's classify them differently, is sort of what I'm hearing from you.
I think that there is a gift in what we call the ADD brain, and there's a lot of talent there that if we understood how that person functions best in the world, instead of making them wrong because we're trying to take a circle and put it into a square peg, like saying, okay, well, where is it that this circle belongs better? While at the same time, thinking about all the functional medicine underlying root cause issues that could be translating into that, how that person is functioning in the world.
Right. Yeah. I mean, I have a 7-year-old and she's been in Montessori her whole life and, doing great, no problems. We switched her to a traditional school. Not that she's having any problems, but they're just sort of, she's used to getting up, doing work, getting up again, putting her work away. It's a lot of up and down and changing. And it's not this, we're doing math now. And you sit here while we do math. And then we go do English and you sit and do English, So we had to intervene of just like, my child needs to get up and stand up more often. You know what I mean? And because she's a very, she has a lot of energy, not in a frantic way, in a very, like, she's high stamina and has been her whole life. And so I kind of think of it that way, everybody learns differently. And just so irritated at this school that it was like, if your child couldn't sit quietly and, listen and do math without anything, suddenly we're suggesting they might have a problem, which of course does not have a problem.
I think that's like the difference between the left brain and right brain world. And like, I mean, I know this is a bigger conversation about our education system,
Yes.
but then it translates into the workplace,
into life. Yeah.
This type of person is trying to find where is it that they fit, and they can't understand why they can't just sit at a desk all day in a 9-to-5 job, or then they have to kind of like override their system by taking an ADD medication that allows them to just become a robot and just sit in front of the computer for hours on end, rather than see that, this is not the style that functions for my brain.
Right. No, for sure.
So I think within that, like, I feel like we need to de-villainize ADD and accept that, maybe there is a part of it that is, there are root causes that we need to unearth, but maybe there's also a gift within it. Maybe there's it's a spectrum of how our brains function.
One of the things that I love most about doing this podcast is I love learning, and I'm a curious person. And so, I always learn something on a podcast. And so I love this idea that you're introducing that, we have a brain and it is on a spectrum, and that, that ADD or ADHD should not be considered a problem. It's just a different brain. So I love that idea, and I hope you can bring that forth. Maybe you can be the person to sort of categorize, different types of brains, and, having us as a society welcome all these different types of brains.
There was a book that came out a long time ago. I think it's called A Whole New Brain or something like that. And in the book, they talk about an experiment in Philadelphia where these kids were failing in their school and they were delinquent. And they moved them into like one of these pilot schools that was designed for right brain individuals. So it was backwards from the left brain, regimented. And the same kids that were delinquent and were not thriving in the one system thrived in this completely different education system. And I read that book many, many years ago. It made me realize that, it's not that they're wrong. It's that sometimes we're trying to make people be one thing rather than see where they're at, which is kind of like, when you think about it, that's what functional medicine is. Mm-hmm. Functional medicine is looking at the individual as a singular person, unique in and of themselves, and seeing, well, within this uniqueness, how can we optimize you to be the best that you can, but also accepting your individual differences from the rest of the world? Mm-hmm. What are your gifts?
So if somebody is, dealing or has been labeled or given a diagnosis of one of these at this moment, we will call them brain disorders because that's how they are labeled in traditional medicine. But, and perhaps your answer to these are going to be somewhat different, but we'll put in the, anxiety, depression to, ADD, ADHD. What is your approach to working with a patient to, help them reverse these conditions?
I mean, first starting with gut and looking at what's going on functionally inside the gut, looking at inflammatory markers, looking at the gut microbiome, looking for any signs of yeast, bacteria, parasites, whatever might be disrupting gut health. Because to me, that's the root. It's like if you're working on a tree, you're first going to work on the root system, and the root system of the body is the gut. So starting there, but I also believe in the bidirectional pathway, the gut and the brain working together. So I'm always also working on mindset and the mind and how the person is approaching life and how they think about things. because I think that is a very important piece of the puzzle. And I think I focus on that more now than ever I did before. I think early on in functional medicine, I was focusing more on the more physical aspects, the diet, the supplements, the gut. And now I approach it more in a dual nature where I am looking at that, but at the same time, I'm working at the way the person thinks, their mindset, the way they approach life, meeting them where they're at, like getting them to do things. Like maybe I can't tell you to go sit and do 20 minutes of meditation. Like you're not going to do that. But can I teach you how to do deep diaphragmatic breathing while lying down with one hand on your chest, the other hand on your belly, so you can monitor the movements of your chest and your belly, because most people are not breathing right. So if we can just start with the basic, even before meditation, like people need to learn how to breathe properly. And I just have them, I tell them, look, set a timer. You're going to lie down because it's easier to breathe with your diaphragm when you're lying down and you're relaxed and you want to wear loose clothing, and set a timer for 5 minutes and forget about the time and just deep breaths in and out. You can do breath hold as well. I get fancier and fancier, but to start, just basic, like deep breathing. If I can get them to 15 minutes, I've had patients' blood pressures come down that were having high blood pressure readings. People become more stress resilient. And to me, it's kind of like finding the hack that works for the person. Because there's the ideal, like let's sit on a mountain and meditate and do all these things, but not everyone is going to do that. So we can find the things that are meditative that are going to help them, even if it's just a walk in nature. There was a study that looked at nature exposure and people's cortisol levels and found that all it took was 3 times a week, 30 minutes in a park or out in nature dropped people's cortisol levels. So me living in a big city like Manhattan, I tell people, you need to get to Central Park. You need to go out into nature. You need to get outside, but also tuning into what is it that you like? Like if swimming is a thing, like you feel really good in water, well, swimming is a really meditative type of sport. So let's get you swimming. Let's start swimming, because so I always try to find where is it that the person feels good, but really working on the mind part as well as the gut to find the things that fuel the soul, things that really fulfill the person. Because a lot of times people are just stuck and they somewhere deep down inside, they know what to do, but they don't know at the same time. They need someone to help them. I have very contrarian points of view on certain things. Like, I think the other thing that we vilify is depression. Like, depression is horrible. We should just be happy. And I look at depression as a messenger. Again, considering all the underlying root causes for depression, but I also look at depression. If someone's feeling depressed, there is a discordance between the life that they're living and the life that their higher self wants for their soul. And I try to find what is at the heart of it. Where is it that they're losing passion? Why are they not happy? And a lot of times I find that that's also really important, like having people journal, having people have quiet inside to really tune into what their heart's desire is. So I'm always, it's so hard to describe sometimes how we work, because I feel like I'm working at multiple levels: gut, body, brain, mind, emotions, spirit,
passion.
I think there's so many things that are influencing our health, including childhood wounds and trauma. And if we don't address these things will be always acting in the background. And you don't know that they're there until you really identify them, right? If you don't look, doesn't mean it's not there. It's just you didn't see it.
I love that I also in the autoimmune solution wrote about relieving stress, not, getting rid of stress. And, kind of like you, what are the things that you want to do? What are the things that you will do? For me, I am a swimmer, and, it is meditative for me. It is like one of that and my hyperbaric chamber, the only place that somebody can like not bother me. Like my phone is off, I'm literally under the water. I can't hear you, and it's just, and the color of the pool and the motion and feeling in the water. And so for me, it's great to hear you say that is meditative, because I've always felt that way. Right. And so it is hard for me, even though I was trained years ago in transcendental meditation, like it's not really appealing to me to sit there for 20 minutes. I would rather go for a swim, or I would have patients say, kind of really not have that glass of wine. My husband and I sit on the balcony and watch the sunset every night, and it's our time to connect. It's like, well, you just recovered from yeast. I don't think it's great that you have wine, but who am I to say that all the endorphins that are coming out, with you connecting with your husband and the earth and the universe, and you're drinking a wine. I mean, I can't tell you that that's actually counteractive. It may be all these endorphins are so good for you while you're drinking that one glass of wine that, that actually is amazingly healing for you. So I just love that, that because we read these books and it's like, do meditation, do this, do that. And for me, it like becomes another stressor, right?
You have to listen. I mean, ultimately, like sometimes I think of myself, and I'm sure you felt this way, like we're body whisperers. We're speaking the language that people's bodies are trying to speak to them. But ultimately, what I'm trying to do is teach the person how to listen to their body. I've changed the style of meditation that I've done over the years. I changed the breath work. I mean, there was a point I was doing Wim Hof breathing, then I was doing different breath holds, then I do Kundalini breath. I listen to what my body is in need of, my body, my mind in the moment. And I think that's really important, instead of becoming rigid, like, oh, I heard this person say, like, you need to meditate, so I should just do transcendental meditation for the rest of my life. Well, but what if that's not what's speaking to you at the moment?
Right. No, totally. I mean, that's really, people say, oh, you saved my life. I was like, no, actually, I really just taught you to listen to yourself and to know how things affect you. Does this affect you in a positive way and you need to do more of that? Does this thing, person, food, environment affect you in a negative way and you need to get that out of your life? So I love that too. I mean, that's exactly, what at least I think I'm doing, and it sounds like you're doing. I don't know if everybody in functional medicine is doing that, but I really think that's all you can do in life, really, is like
the guru is inside.
Right.
The ultimate guru is inside, and the person always knows what's best for them. And we can suggest based on a person's preferences, but they also need to discover what is right for them. But for me, it's an absolute. It's not a non-optional, because a lot of times when I ask people, well, what do you do to de-stress, or what do you do to relax? A lot of times they just look at me with a blank stare. Mm-hmm. It's like, well, okay, let's explore that.
I do think for many people, myself included, I always, admit it whenever I'm being interviewed, it is kind of, there are 5 factors that I believe cause most chronic disease, and stress is one. And it is definitely the thing that I, put on the back burner. I mean, as I'm getting older, I just can no longer put it on the back burner, right?
We also become more rigid as we get older. And I can say that now. I'm 50, so half century. And that was a big birthday for me. For some reason, turning 50 felt old. And I never felt old before that. Mm-hmm. Now I can say, 9 months or whatever, 10 months into 50, I feel younger than ever. And part of that is because I've decided to incorporate a playfulness into my life. And I think that's the other flip side, is that when it starts feeling like a chore and it's not fun, it's not going to help anymore. But if it can be playful, like bringing play back into our lives, I think is a very important part of the healing aspect, and something that we don't really talk about a lot, because we get, and especially in functional medicine, like it can get pretty serious with patients. We're dealing with some really sometimes chronically ill people, whether it's candida or like a chronic tick-borne infection, whatever it is, it can get very serious. And And that's where I'm always grateful for my mom. She was a half glass full person. And she always tried to find the humor even in the worst situations. And I think sometimes we need to remember our humor, like not lose our humor, even when everything is just crap.
Yes.
Like find something to be grateful for and find something to have humor about, because it's just so healing. Laughter is healing.
I have a 7-year-old, so that definitely keeps the play in my life. But I'm ahead of you by almost 5 years. So I had that birthday a couple of years ago now. And yes, I mean, I think I don't feel old, probably because I have a 7-year-old, but it just changed my priorities about things, as people are getting older, or getting, diseases or passing away and things like that. It's just changed my priorities about things. But yes, like when I'm starting to get in, headbutt with my 7-year-old, I don't know what's going to happen when she's 17. Sometimes she's like, oh, you're being so mean. I'm like, really? How mean am I being? Show me how big, and just try to, I can't always do it. Sometimes I'm too in it myself, but, turn it into something playful. And then, she starts laughing and I start laughing. And then, this tense moment has completely devolved into, tickling and laughing and, all of the things.
That's an important part of the healing prescription, when dealing with the physical, is remembering all of these aspects. Because sometimes it's just that. It's that laughter and play is missing in a person's life.
I know that you needed to run here very soon. So before we part ways, I do like to ask, what are 3 things that our listeners can do today to take back their health?
1, learn to breathe. Breathing with your diaphragm. That is incredibly healing for the body. Find something that you love and try to do it at least 3 to 4 times per week. So if that is a stroll out in nature, whatever it is, something that feeds your soul. And since I'm a gut expert, I'm going to say throw in some fermented foods because they're good for your gut microbiome. And kefir, there was a study that showed that taking a dose of kefir every day lowered anxiety scores in women. So throw in the fermented foods if you can. I know not everybody listening, some people might have histamine issues and stuff, but if you can, even if it's just a half teaspoon and slowly working your way up, because I think ultimately there are such great benefits to fermented foods in creating a better health environment for us in our gut.
And this is where I'm a little controversial on this topic. I think those that have candida or SIBO need to heal their gut first before they add in the fermented foods, because you just kind of can be feeding those to overgrowth situations if you haven't cleared them. And
I would actually agree with you on that.
Okay. All right. Because some people, not being able to tolerate fermented foods is usually a clue to me that, yes, it could be histamine intolerance, but usually the root of that is SIBO, or it could be candida overgrowth.
Yeah.
So if you can't tolerate fermented foods right off the bat, it may be that you have one of those infections. Okay. And then where can people find you?
Easiest place is on Instagram at Dr. Pedre. They can also follow me at happygutlife.com, where I have tried to make really interesting blog posts about all sorts of topics, gut, brain, gut related, benefits of coffee, all sorts of really cool stuff that I write about.
So do you want to, I think you just launched a coffee company.
It's actually coming soon. It's going to be Happy Gut Coffee. It's going to be launching, well, I don't know when the podcast will be up, but we're doing a soft launch in July. And then we're going to be doing actually a launch with a Kickstarter campaign in October.
Okay.
For Happy Gut Coffee, which is organic beans, low acid, gut friendly, and they taste great. It's a French roast.
And do you have time to tell us the connection between the gut and the brain and coffee?
Oh, so many.
Okay.
So many. I mean, just the polyphenols in coffee that get metabolized by the gut microbiome and produce all sorts of postbiotic products that are good for brain health. And even also, there was a study showing that the trigolinine in coffee actually helps prevent muscle wasting. So for people who are older that need to maintain muscle mass, it's so important. So there's a lot of really cool stuff on coffee benefits for the body and the gut and the polyphenols. So
and are you going to be?
You'll have to have me back to talk more about
I will,
that.
absolutely. And will you guys be doing any testing for mycotoxins and molds on your coffee, or?
We will look to that. Yeah.
Okay, cool. Awesome.
Yeah.
Well, great. Well, awesome to chat. Thank you so much. Great to catch up as well.
It's great catching up.
I want to thank this week's guests for sharing their time and knowledge, and thank you for listening. To read the full show notes for each episode, which include a summary, timestamp, quotes, and any resources mentioned, please visit amymyersmd.com/podcast. Lastly, if you've enjoyed this episode, I'd love if you would leave a rating and a review on Apple or Spotify, and we'll select a few to read out loud in a future episode. Tune in next week to hear from another inspiring guest as we help you take back your health.